Good afternoon. We are going to be finishing up the Jobs and Energy Bill today, and then moving to the Health and Human Services Bill. And I think it's really important to frame up the context of the Health and Human Services Bill that we'll be proceeding to later today. When we went out and ran for the legislature in the 2018 election, Minnesotans were really clear with us. They value affordable and accessible health care for themselves and their families. They were not asking us to put forward an austerity budget that cuts accessibility to health care and makes health care more out of reach for them. So we responded to what Minnesotans asked for. And we have put a Minnesota Values budget forward that works to ensure that every Minnesotan has that access to affordable health care. We're not in favor of giving more unsustainable giveaways to pharmaceutical companies and insurance companies. We're really focused on the consumer and making sure Minnesota's healthcare consumers have better options in front of them. We are protecting the Healthcare Access Fund. We know that this stream of revenue provides healthcare for more than 1 million Minnesotans. There is no plan out there by any other entity to replace what the Healthcare Access Fund provides for more than 1 million Minnesotans. We're protecting access to women's health. We're addressing the rapidly increasing cost of prescription drugs. The Senate Republican target is woefully inadequate. But worse than that, it's not an honest budget. The Minnesota House DFL budget is an honest budget. The Senate Republican budget, to the extent we can figure out what it is, because their HHS package isn't yet complete, there's shifts and gimmicks. There are things that are not sustainable, not actuarially sound. They propose to transfer budget balances that may not actually be there. There's 18 notes on the Senate fiscal spreadsheet for HHS. So first of all, they need to try to do their homework and put forward a real budget. Our budget is honest. We make investments in Minnesotans. We work to make healthcare more accessible and more affordable.
Good afternoon. Starting yesterday with our K-12 bill, and yesterday and today with our Jobs and Energy bill, and continuing on today with our health care bill, Minnesota Democrats are focused on family economic security and opportunity for all people in Minnesota. On health care, we are going to be proposing accessible, affordable health care. We are going to be taking on pharmaceutical companies that are ripping off consumers and driving people to the point of not being able to pay for their own basic health. We have a very ambitious agenda in the healthcare area. In contrast, destructive Republican budgets are going to undermine the basic health security of thousands and hundreds of thousands of Minnesotans. Their budget bill doesn't work. The 18 notes that the Speaker referred to include transfer balances that don't exist, implementation that won't be likely because of the federal government not approving it, rates that are not actuarially sound. And so they have a tricks and gimmicks HHS budget because they know they can't cut spending the way that they want to do without harming Minnesotans. That is fundamentally why they are dishonest about their budget, because they know that Minnesotans won't accept the kind of proposal that their level of spending and tax giveaways requires. So we understand that the House and Senate are going to be in different positions. We take the position that Minnesotans can handle the truth about what it costs to have quality health care that's affordable in Minnesota, what it costs to have quality education, what it costs to retool our economy for the jobs of the future. And so we present our opening position through these bills as an honest, open approach to what Minnesota needs from our point of view, not hiding the ball and not trying to cover up for the fact that we don't have the courage to be honest with Minnesotans.
Question.
Representative Liebling, if I remember right, Mayo Clinic has opposed provider tax. Is that still the case? And if so, why would you go against the big employer in your community?
Well, let me first say that the Hospital Association, which represents hospitals all over the state, including Mayo Clinic, is firmly in support of removing the sunset and continuing the provider tax. And they have testified in committee repeatedly that the rural hospitals are in real trouble if we allow the tax to sunset. So I haven't heard a lot from Mayo on this topic this year. I think Mayo's doing extremely well financially. I know this isn't something that Mayo loves, But I think Mayo's kind of resigned to it because the system is really dependent on the continuation of the Healthcare Access Fund and all of the things that it pays for, including really keeping our entire system afloat. So if that goes away, it's really bad for everybody. The other thing I just want to say is that even though Mayo's in my district, I've always said I don't work for Mayo. I work for the people of my district, and the people in the district, on the whole, I think understand that it's really important that we maintain our system and that we continue to provide care for the 1.1 million Minnesotans who are on our public programs. And also, let me just remind everyone, the Healthcare Access Fund also provides a lot of service for everyone in the state in terms of health improvement, in terms of activities that take place in our Department of Health that really support everybody's health and well-being. So we are very interdependent, and we will be in a great deal of trouble if we allow that provider tax to go away.
What's your amendment count?
What's our amendment count?
It's around 100, including the secondaries, I think.
These transfers you're talking about, you're saying that they're banking on money that isn't necessarily there, like they're counting on the provider tax or the health access fund?
Are you talking about the Senate? Yeah, may I just say, just to give people a bit of context to that, the spreadsheets are put together by nonpartisan fiscal staff. And so what the Speaker and the Majority Leader were talking about, these notes that are on there, they're like asterisks, where you'd say, it says this on the spreadsheet, but whoa, wait a minute, that really may not play out. So it's the nonpartisan staff whose job it is to really make things work, saying, we can't stand by this one, we can't stand by that one. That's what we're talking about.
So 18 is a lot? Is that an abnormal number of, no?
I've never seen anything like it. The other thing that's very significant is right now that the Senate Health and Human Services bills, the language in the bills, does not agree with the numbers in the spreadsheets.
Does your bill do anything to realistically help rein in cost?
Representative Liebling.
Well, it does. And one of the big areas that our bill reins in cost is in the area of drug prices. So this is a very difficult thing. I think everybody knows that drug prices are just going through the roof. It's a huge driver of healthcare costs generally. And it's a very difficult thing for states to get our arms around. I think probably every state is struggling with this. But we have some really important provisions in this bill. One of them is we have a provision that begins to rein in what are known as PBMs, or pharmacy benefit managers, that really are taking a lot of the money that consumers are paying and really taking it for profits. This is one of the biggest earning industries that we have, are the PBMs. So we are licensing them, trying to get our arms around making sure that they are using consumers' money the way it's supposed to be used, and that we know what they're doing. Another big way that we're doing that is a package that comes out of the governor's proposal to have a pharmacy package, or one benefit that would start out with our public programs and later on be available to everyone. What this does is use the state's buying power to try to bring down prices. And I'm really excited about that because I think it's one of the real things that we can do as a state. We are, 5.5 million people? That's a lot of buying power. So that's a really good way to get our prices down. And there are other pieces as well.
Aside from the Healthcare Access Fund, what are some of the biggest differences between your bill and the Senate bill?
Oh, my goodness. There are a lot of differences. One is, for example, the Child Care Assistance Program. We are really cognizant that working families are struggling to afford child care. Absolutely essential. If you're going to work, you got to have somebody watching your child. We are strengthening that program. We've got program integrity pieces to make sure that the money is being used appropriately. We're also doing federal compliance, raising rates as we're required to have the program comply with federal requirements. What they're doing in the Senate is just cutting it all out. Originally, one of the bills in the Senate, Senator Abler's bill, just got rid of the program altogether. Now I think he's doing something else where he's putting it on pause for a while. Yeah, but in fact, you can't do that because we would be out of compliance with our MFIP, our Minnesota Family Investment Fund, would be out of federal compliance. And so there is a risk that even if we all decided to do that, we would very likely lose funding in what's known as the TANF fund, the block grant that we get from the federal government to support our program for low-income families. So there are all these interactions that are really problematic.
Representative, what assurances specifically can you give Minnesotans that we don't have another round of fraud that has had, in CCAC specifically, that has had a lot of attention?
We have a lot of new program integrity pieces in the bill. So Representative Pinto has worked very hard on that, and I'm sure we're going to have a lot of debate on that today. But, you know, just to be honest about this, you can never completely assure that there is no fraud in anything. I don't think any of us can do that with anything that we do. But we are going to try darn hard to make sure that fraud doesn't occur, and that when it does occur, that we catch it, because we will never have enough money in this state to waste a single dollar of it. And this is a very, very important program for families.
And can I just say, we are going to address the merits of that issue, but the claims of fraud have been wildly exaggerated, irresponsibly exaggerated, and turned into racist and Islamophobic attacks on communities in Minnesota, and we are not going to do that.
Mr. Leader or Madam Speaker, will the sheer volume of amendments force these omnibus bills into the weekend? Talking about Saturday session?
This is
You
the
have plans,
last.
John?
This is the last weekend of Passover, so we will be adjourning at 3 p.m. on Friday. If necessary, we will come in on Sunday, and we, potentially would not be leaving until all the work was done. I think that it's irresponsible, just from a management of people standpoint, for the Republicans to adopt a tactic of just filing excessive amendments and causing delay. We had a significant health issue last night. We have a lot of people whose health doesn't do well after 19-hour days, consecutive 24-hour days. And I think that there's no reason we can't get our work done in daylight hours, but it's really a decision by the minority. If they want to have a constructive conversation about the bills, we are ready for that. If they want to dig in and just delay and make things take forever, we'll be here many hours. But, my frame of reference is, having raised 2 children, that it's like putting pajamas on a toddler. We're going to do it the easy way or the hard way, but we're going to do it. So it will either take us several hours in the middle of the night to pass some of these bills, or we can do it during daylight when Minnesotans can participate and weigh in via text messages to us and emails to us.
There was a health issue with a member, staff?
A member.
Can you talk more about that?
No, I can't, because it's private information.
I have a question about the Tobacco 21 bill. If you could touch base on that for me.
Absolutely. Well, Tobacco 21, raising the age to purchase tobacco to 21, is in our bill, along with some other provisions to help continue to try to protect Minnesotans against the ravages of tobacco. And we have Clearway, Minnesota, the program that we've had for a number of years that came out of the tobacco settlement is sunsetting. So one of the very important things we're doing in our bill is continuing that in the Department of Health, those efforts to help Minnesotans quit smoking. And really, the Tobacco 21 is a very important effort to try to keep kids from starting on this really addictive substance, nicotine. And we've seen recently that the smoking rates, or the use of vaping in particular, has gone way up. We're also adding vaping to the Clean Indoor Air Act, which is, again, part of our effort to try to keep kids from starting to smoke.
One of the questions I think that you should pose to the Republicans when they talk about their HHS bill with you is what areas are they putting federal dollars at risk? Because in the pharmaceutical area, if we don't comply, they're putting $190 million at risk. Their reinsurance proposal puts $90 million in federal dollars at risk. There are a number of things that we're doing in our bill to comply with federal regulations so that we do not put any of the money that Minnesota receives from the federal government for healthcare at risk. So I will be interested to see when their bill is finally put together, and hopefully at a future moment in time when their spreadsheets and their language agree, how much federal money they put at risk.
Madam Speaker, could you talk a little bit about the Senate tax bill that was released this morning? They noted that it's very different from the House tax bill.
I can't say anything about it because I haven't seen word one about the Senate tax bill yet.
But it does fit on one page, I think, so far, so it's not really a tax bill, it's more like a tax gesture.
Representative Marquardt will be talking about taxes with you very soon. I think the amendment filing deadline for the tax bill was today at noon. We only had 16 amendments from the Republicans on the tax bill. I think they would all like Chair Marquardt to remember their provisions fondly. So there sounds like there's going to be a lot less debate maybe on the tax bill, or at least amendments. That will be after HHS. So at that point in time, I think Representative...
Tomorrow-ish.
Tomorrow.
In the coming days, and Representative Marquardt will be able to give you a little bit more information because no doubt he's studying the difference between the two.
Speaker, with all the differences between you folks and Senate Republicans, whether it's on the bill you're talking about now or anything else, how optimistic are you that you can actually come to an agreement?
Senator Gazelka and I still feel really good. You have to look at the 3 new deadlines that we adopted this year that have really driven progress. I mean, first of all, the 3rd deadline where all of the finance bills were to be completed in each body by April 12th. That gave everybody from April 12th until now, when these bills are on the floor of the House and the Senate, to look and see what's in them. In the past 4 years, we haven't had that moment in time far enough ahead of the floor debate for people to even understand what was in the bill. So that's a big accomplishment right there. The folks in the Walz administration with experience like Commissioner Myron Franz speak of it like it's a miracle. So that's one piece. But then you have dispositionally. I don't look for conflict. I don't look to increase conflict. Representative Doubt loves conflict. He loves that mixing it up, the game part of politics. Senator Gazelka and I are a little bit more same tempo of let's try to find the places where we can agree. And if we have to go to the 50,000-foot level and slowly descend down into the details, that's what we'll do. But a lot of action happens in the legislature in the last 4 weeks. Hopefully this time it'll be over the last 4 weeks, not over the last 4 days. But the other thing I'll say is don't look for kumbaya every minute of every day here at the legislature. We are making sausage. There's a reason why lawmaking is referred to as sausage making. It will be messy. There will be contention. There is supposed to be conflict. There's supposed to be strong disagreement. But I think just because you will see that on the floor debate in both the House and the Senate does not bode ill for our future negotiations.
So you don't see the, what's going on the elections security fund bill, HAVA, as any harbinger of things to come?
I think the management of committees and personalities is a challenging part of the leadership job, and I'm certain that Senator Gazelka will fulfill his word, which is before the session's done, that money will be released.
Can I just add one other thing? So from a House point of view, we have a lot of things that we would like to do in almost every budget area. So we are creating as many paths of compromise and ground that we can work together with the Senate on as we possibly can. We don't know yet where or on what things they will be most willing or able to work with us, and so we're creating as much opportunity for compromise as we can. So it's not like we have 2 positions that are staked out far apart. It's more like where do we interlock and come together at the end, and we're trying to create as many ways to do that as we can.
Mr. Leader, along that same line, and Madam Speaker, one of the things that the governor has indicated he might be open to is some level of reinsurance as a bridge. What's generally your attitude on that?
We will pass our budget bills by May 1st, and then we will start those conversations.
Thank you. The other thing I just have to say about reinsurance is that it puts significant federal dollars at risk. And so we're happy to talk to the Senate about ways to improve healthcare in Minnesota, but we all have to be cognizant of not losing federal dollars that we're entitled to.
Madam Speaker, they're also saying the Human Services bill just spends too much generally, and that's obviously the problem. They say that's the problem in all areas of your budget, but would you just address that?
We're working to provide affordable and accessible healthcare to all Minnesotans. And Minnesotans know that healthcare isn't free, and so we have to pay for it. Our budget honestly pays for what we're doing. Again, I will tell you that Minnesotans did not ask any of us to reduce their access to healthcare during the last campaign. They asked us to increase access to healthcare, and that's what our budget does.
Thank you.